Hi, I'm Dr. John Fitz. I'm going to talk to you a little bit about dry eye, a very common condition in which the tear film that overlies your eye dries out. A better term for this disease, I think, is called tear film insufficiency. Because the weird thing about dry eye is that your eyes get a burny, gritty, sandy feeling, and your eye actually starts to water. The gland used for crying for emotional purposes kicks in to give you extra water, and it dries out and it gets a gritty feeling again, and then boom, it kicks in with extra water. So paradoxically, when people have dry eyes, their eyes tend to water all the time. The deficiency is in the tear film that overlies the eye on a daily basis to keep your eye lubricated, and the crying gland tears aren't really used for that purpose. So how do we improve that? Well, you can use temporary improvement with eye drops, artificial tears, which we'll be discussing in more detail in a few minutes after the movie. You can use sometimes oral treatments with the so-called omega-3 fatty acid supplements, or sometimes the tetracycline-based antibiotics can be helpful. Sometimes we recommend lid scrubs to help relieve any infection tendency that's going on at the same time, making the dry eye worse. There's even prescription medicines in an eye drop form that can truly stop the disease from progressing in many people. It's called Restasis. And there are other treatments that I haven't even mentioned. So there's a lot of things we can do. Sometimes we have to use punctal plugs, little silicone plugs that are like corks you cork a bottle with. There's these little tubes that carry eyelid water from your eyelid down to the back of your nose. And if we plug up the drainage system, that can keep more water there. And a lot of times we end up using some combination of these treatments. But I believe the vast majority of patients can be significantly improved in their symptoms, and in some cases we can stop the disease from progressing by using the proper medications. So sit back, relax, watch this movie, and we'll be discussing these treatment options in further detail and which ones we recommend for you.